to have been involved in being able to give this care to our patients. And this has been possible only because of the strong clinical team that we have across our group. You know, we are 4 hospitals in Bangalore and other hospitals in Karnataka. Transplant team, our liver transplant team, which I think is best in class in South India today. And also the kind of equipment and infrastructure that we have, which enables us to do this. And the team which has supported in making this complex case have such a wonderful outcome. So that includes, you know, behind our surgical team here, there may be around 40 to 50 people who have supported in the hospital, whether it is anesthesia, whether it is our intensivists, nurses, technicians, back-end support. All of them have come together by which we have been able to achieve this beautiful outcome.
You all to come and in taking some time out from your precious day and come here. The reason we wanted to highlight this is at this moment we have a severe shortage of donor organs. We with one donor can get one liver, and there are multiple, more than 1,000 patients waiting for liver at this moment, and there is a severe shortage. So a lot of people die on waiting list, waiting for the organ. So in that case, we have to use different strategies to make sure that we can increase the donor pool. Basically, make sure that there are enough organs for patients waiting on the waiting list. And for the patients waiting list, patients who are waiting on the waiting list, it's a severe issue. As in, you know, they don't know what to do, and it is pretty bad experience as such. So to increase the donor pool, one of the strategy used is split liver transplantation, which is we use one liver, cut it into 2 halves, and give one part of the liver, right lobe usually, to the adults, and a smaller part, which is the left lobe, we give it to the child. What's unique about this case is we could use the liver in 2 fully grown adults successfully and with good outcome. Now, why this is a rare feat, not many cases has been done with this kind of one liver used in 2 adults, and that's why we wanted to emphasize on it. Very important thing to do something which is so complicated is to make sure all the logistics are taken care. Once we take the liver out, it should be transplanted into the recipient within 2 hours, 3 hours, as soon as possible to get the better outcome. So overall, if you have good systems, a great team to work with, and all the requirements are there, then it is feasible to do something like this successfully. In addition to that, I would definitely like to thank Yeswanthpur, which is our nodal organ donation and procurement agency, Government of Karnataka, who did allow us to say, okay, you go ahead and do this. And I would like to thank all my teammates who worked incessantly and without any tiredness to achieve this thing. Thank you.
Points, Dr. Gautam has already covered why it is important to use maximum number of organs for maximum number of patients so that we can save more lives. If you ask, what is critical, which are the steps that are very important in achieving this kind of successful outcome, every step of the procedure, right from selecting donor, who is a good donor, where we can cut the liver into 2 halves and use it for 2 patients, that is where the process starts from. And once we identify a organ donor, who's suitable, whose liver can be split into two halves. Then the next step will be to identify, how to do it. Like, we have to do multiple scans, identify those blood vessels, cut the liver into two halves. Whatever blood vessels needed reconstruction, we have to reconstruct them on the back table. And, after doing all this, the new liver has to go back into the recipient in a short span of time. And because there are, if you imagine, there were totally about 3 surgeries happening at the same time. You may see only 2 surgeons here, but there were at least 50 people working on the background to make this, for us to see this happy day. So every step, right from selecting the donor, selecting the ideal recipient, performing the surgery, whatever has to be done in the surgery so that the 2 patients are safe and successful. If there is one mistake at any one step, we would not be seeing a good outcome. So every single step is so important here. And we have to make all these decisions in the middle of the night when, probably we are most tired. So this is when good communication, good team, and a lot of support system, that helps us see this successful outcome. Thank you.
Right time to be part of this significant event, this part of the country, where it's unimaginable a few years, if not a decade ago, to see 2 people sitting here who have received an organ from one donor. So science has advanced so much that we are able to reach this mile, and like Rahul sir told that SPARSH always yearns to be a destination for complexities, and we take every new frontier as a challenge to achieve and go all the way to achieve that and include that into our service portal, and always we are on the lookout for what's out there in the frontier. So to begin with, all of us understand that for any successful transplant program, the center point would be a wonderful pair of hands. So we have been fortunate and blessed to have that with us. We have a wonderful team of surgeons, which becomes crucial for the outcome of the surgery. But we also have to understand is all transplant recipients have a failing organ to start with. And a major organ like liver, if not functioning, we can understand their immunity is going to be very down. And the moment they receive an organ from a donor, our body, a natural response is to push it away from the body, a process what we call rejection. So we use medicines to kind of regulate these processes. So all collectively will compromise the patient's immunity, and that with them puts them at a high risk for infections. So we, the transplant organization, are very conscious about that and have taken every effort to make sure that a new infection doesn't affect them or an existing infection doesn't flare up during the post-transplant period, which is very crucial for successful outcomes. So in our organization, we keep this transplant cohort, if I may use the word cohort, because we have a very successful and robust transplant program, including the liver programs, we have renal transplant programs, we have the heart and lung transplant programs, we have the bone marrow transplant program. So this cohort is the most vulnerable people in the hospital. So whatever decision we take in the hospital, they are at the center and everybody works around them. So like they mentioned, it is an outcome of a collective effort of a huge team, right? From our coordinators who follow up with the transplant recipients and the donors, and the intraoperative support team, right from the scrub nurse to the assist nurse to the OT committee, right from the nursing team under the able leadership of a nursing superintendent, the infection control team, the housekeeping and the maintenance. We make sure that even the air that enters an OT facility and the post-transplant care facility is taken care of, are filtered, and the risk for infection is bare minimum. And if at all we pick up an infection, we have all the infrastructure and expertise to address this with capability to optimize the outcome. So at this point, definitely, like we understand, the surgeon's role is paramount, but it is a collective effort, and the collective efforts of a huge group of people have brought about this wonderful results. At this point, I congratulate the organization and each and everyone who have contributed to the successful outcome. And we are also grateful for the families who are entrusting their faith on the SPARSH team. At SPARSH, we look to offer hope to the people who come to us with faith, with love being the common denominator against which we mark all our activities. These few words, I conclude my comment. Thank you.
Were not taken at the appropriate time in a correct way, we would not have seen 2 live patients here. So that is the risk we are talking about. The risk is death for our recipients if the decisions were not right.
So, your first question, how many people waiting for liver transplantation in India, right? So, we don't have very robust data on how many people need it, but the calculation is around 20,000 people per year each liver transplantation in India. And at this moment, we are doing around 4,000 cases, in which half of them are done in foreign. So we are only doing foreign nationals. So only 2,000 Indians are getting liver transplantation in India who are needing it. In Jiva Sarthak, which is a Karnataka nodal thing, around, if I am not wrong, there is around 500 to 600 patients waiting. But you have to realize that this is rotating population. A lot of people die on waiting list. So they cannot wait for usually not more than 1 year for transplant. So some patients may need it earlier too. So if you are waiting on a liver transplant list for more than a year, the chances of you getting a liver transplant is very low and you will die in the list. It's called wait list mortality.
There is a mortality risk.
And which is very high, at least in Karnataka and India. It is very high. Question you had is what kind of infrastructure and innovation it is needed. Actually, it is very complicated. The hospitals, the infection risk post-transplant, all these things put a lot of pressure on recovery. But overall, if they get a good liver with reduced ischemia time, 90% to 95% patients recover well. And once they recover without much complication, then their lifespan is similar to a normal individual and their quality of life is similar to the normal individual. And most of our patients die with the working graft. That means they die with the liver working. Having said that, there is a 5 to 10% risk involved with the overall procedure, mostly because of infection and post-transplant rejection and other problems we face.
See, you asked about the liver problem, so I will give a demographic view. Say, if you ask how many people in the society have liver ailment, that roughly translates to 10% of the population. If you imagine India's population, 10% of the people have, this includes minimal fatty liver to severe end-stage liver damage as well. The whole spectrum is seen in about 10% of these patients. 10% of the 10%, that means 1% of the Indian population will need liver transplant at some time in their life. So that's again a huge number. And you can imagine how many organ donors there are. There are 2 ways to get a new liver. One is living donor, other one is a cadaver donor. Living donor is where half the family member shares half the liver with their near and dear ones. Cadaver donor is like what we have done today. People who are unfortunate enough to succumb to a accident or a head bleed. If the family is willing to donate organs, they can be distributed to people who need them. Certain family members, even though they are willing, they may be medically unfit to donate half the liver. So such families don't have any other option but to wait for an organ donor from the community. So with a nuclear family being the norm now, smaller and smaller families are there. So even if their family member wants to donate, they may not be fit. So that is part of the problem. So that is one of the reasons why we want to promote organ donation more and more. See, we ventured into this feat of splitting the liver and giving it to 2 patients. One is risk involved in the surgery, other one is, say, suppose if we had not done this, the one organ would have been given to 1 patient. What about the other patient? They have to wait for their turn to come up again, and by the time the turn comes, they may be unfit or, like if they have cancer would have grown back, making them, not suitable to receive a liver transplant. So risk is there in both, deciding to split the liver into 2 and make or if we give it to one, making the other patient wait on the waiting list. And there also risk of losing patients on the wait list can be as high as 50-60%. If 100 patients go on the waiting list for the cadaver donor organ, 60% of them die living in a hope. We can only provide to 30-40% of the patients, or maximum 50%.
This would avoid oily foods or something like that. So this is what I wanted to know. Is there any dietary conditions for the post-operation transplant for the patient?
Yeah, whatever lifestyle you are supposed to follow, I am supposed to follow. It's exactly the same lifestyle our patients will have to follow, but much more strictly. Saying, we are a little careless. Sometimes we eat food from unhealthy source or from roadside or.
That's the reason I asked you. Is there any dietary conditions so that they can have a best result out of it?
Yes, we educate all our patients about the medications they need to take, about the environment that they have to live in, and about the food they can eat and they cannot eat. It is not very strict. If you look at it that way, the kind of restrictions our patients are told to take is not very different to what we are supposed to follow, but they have to follow it more diligently. You can get fever, I can get fever, and so can they. If we are not careful, if we don't wear mask and go into a crowded place, we can get cough and cold, so can they. But problem with them is with all these medications that they are taking, if they develop fever, we will be forced to adjust their medications up and down, and that can come back to hurt them at a later date. So, it is exactly the same lifestyle that you have to follow. They have to follow it stringently, and the room for error there is very small.
Infections. That is the basic thing. So we do not ask them to eat roadside, of course, and they don't have any restriction like a diabetic has. But if they are diabetic, so half of our patients are diabetic, so they will have to follow those restrictions.
Dr. Smile. Salute the camera.